Welcome back to part 2 of the anti-infective drugs. Now we'll be actually going into the different classes of antibiotics and how those different classes of antibiotics work. So my slideshow is about to begin, and here we go. Okay, so we're talking about cephalosporins, and it's very important to know that cephalosporins are in 4 generations. And I'll just kind of move on here. There's 4 generations, and then as far as how they actually work, they affect the cell wall, and what it helps break down the cell wall, and then allows your body's natural defenses to go in and kill the bacteria. I'll be showing you a chart at the very end, which will help summarize some of this up, hopefully. Some important things: patients who've had a history of allergic reaction to penicillin, there is a 10% chance, and this may vary depending upon which textbook you read. I've seen it as low as 5 and as high as 30. Fairly consistent with 10%. That if a patient allergic to penicillin, there's about a 10% chance of allergic to cephalosporin. I'll show you why in a moment. Because of something called a beta-lactam ring, which both of these, Encapsulates is a cephalosporin. It's a first-generation cephalosporin, and penicillin both have this beta-lactam ring. So again, there's about a 10% chance for patients allergic to penicillin that they'll be allergic to cephalosporins. Clindamycin is an alternative. So if the patient is allergic to penicillin, they can take clindamycin as an alternative. And the way that the clindamycin works is by protein synthesis. And I'd like to point out that it's mostly against gram-positive organisms. Fluoroquinolones are very popular antibiotics, and they are synthetic. And they did have these broke down into generations. And as 4th generation fluoroquinolones, they were Tequin, Avalox, and Trovan, but Trovan and Tequin have been taken off the market, so the actual only 4th generation fluoroquinolone is Avalox. And I do list examples of some infections that the particular antibiotics are used for, but just keep in mind that the antibiotics are broad spectrum antibiotics, so that it can be used for both gram-positive and gram-negative. Fluoroquinolones, the way they work, and I'll show you on the chart at the very end, a couple different ways that you may see on a particular exam. But it does affect DNA gyrase, and DNA gyrase is only found in bacteria and not in humans. So this is the reason why we can give fluoroquinolones and it does not affect human DNA. And again, I've listed some examples of Levaquin, Flox, and Tequin, and these are just examples of fluoroquinolones. Tequin now has been taken off the market. Some adverse reactions that I would like to point out. Some unusual adverse reactions. One, the phototoxicity, photosensitivity. You'll see that with a lot of antibiotics. But depression, drowsiness, and potential hallucinations. I've had a couple of patients describe the hallucinations while taking fluoroquinolones. Specifically, Avalox seemed to cause it more than the other fluoroquinolones. So that is definitely a potential side effect that the patient may have. The next is there is a potential for it lowering the seizure threshold. So very, very important to keep that in mind to a patient who has had a history of seizures, especially uncontrolled seizures. Macrolides, some very common macrolides, azithromycin, fluoroquinolones, and erythromycin. We're probably most familiar with azithromycin as a tri-pack or a Z-pack. So this is either taken, a Z-pack is taken for 5 days, and a tri-pack is taken for 3 days. And it does affect protein synthesis, and it is effective against both gram-positive and gram-negative bacteria. So it's a broad spectrum antibiotic. Side effects, photosensitivity, give with food, etc., just like you would with the other antibiotics, potential side effects. Penicillin, the first antibiotic it discovered, Alexander Fleming discovered it, and I've got gram positive, gram negative. Plain penicillin itself is going to be more gram positive. It does have a little gram negative, but when you start to go up to like augmentin and ampicillin, then you start to go into the more broad spectrum. But looking at just plain penicillin, it's going to be more gram positive. And again, with the potential of anaphylactic reaction with penicillins. Tetracyclines are broad spectrum, and they penetrate tissue very well. They're against both gram positive and gram negative. And the way they work is they inhibit protein synthesis. Now, I have up here they're used to treat Rocky spotted fever, Lyme disease. This is just something unusual that you typically don't see. So that's the reason that I mention this. But just keep in mind that you can use tetracyclines for any bacteria that it's susceptible to. However, it is indicated with Rocky spotted fever, Lyme disease to use tetracycline. There is a potential of tooth discoloration in young children. So young children should avoid tetracyclines, and there is a photosensitivity with tetracyclines as well. And again, give with food. Vancomycin, we're starting to see a lot of resistance with vancomycin. You should only give vancomycin after doing a culture insensitivity test, hopefully to prevent some of the resistance. Adverse reactions, just as before, potential anaphylactic shock. You want to assess the patient's renal status before giving that. A new antibiotic has been on the market for maybe 6 or 7 years. It's Ivox. It's rarely used. It's very, very, very expensive, and I'm going to guess probably around $80 to $100 per tablet. So it is very expensive. It inhibits protein synthesis, mostly against gram positive. It is well tolerated, and there's a potential of interacting with some medication. Last, I'll talk about Septra and also maybe Bactrim are two brands that you'll hear. And I have up here UTI. Just keep in mind it can be for any bacteria that Septra is susceptible to. Typically, we see Bactrim receptor used with UTIs. Also, you can put a patient on who's an immune-compromised patient on Cephalosporin is typically a good drug of choice. You'll see it used quite a bit for patients who have immune-compromised immune systems. And the most important with Bactrim and Cephtra is there is a sulfur allergy associated with this. So if the patient is allergic to sulfur, they should avoid taking Bactrim or Cephtra. This is a very important point I want to stress there. The next part I'll go over is viruses, and I'm going to go over this very, very quickly. As a matter of fact, I'm not even going to cover viruses in this particular PowerPoint. I'll save that for another PowerPoint. What I do want to go over, though, is this. Hopefully you can see this well. I want to point out up here we have cell wall synthesis. So a couple of things that I talked about was penicillin, cephalosporins, and I believe I also talked about vancomycin. So they inhibit the cell wall synthesis. The next thing I talked about was protein synthesis. So what it does is it affects translation. So it inhibits the protein synthesis. And then we talked about fluoroquinolones. Rifampin I don't believe I discussed. But fluoroquinolones, now quinolones and fluoroquinolones are the same thing, but they affect the DNA gyrase. However, you also the transcription and replication it also inhibits. So it works a couple of different ways to kill the bacteria. So those are three very important ways that antibiotics actually kill the bacteria.